are here with Dr. Jyoti Deshpande, who is a professor at Symbiosis Medical College. Hello, ma'am.
Hello.
Ma'am, firstly, we would like to know what is the importance of this workshop.
So for the learning curve, it is very important understanding the detailed anatomy of the various nerve block. We can understand the path of the nerve, various facial planes, vascular structure. So we can understand the anatomy in detail. So it is like a reverse anatomy. You scan, you dissect, and you can do the needling. Needle trajectory can be beautifully seen in the cadaveric workshop. We can inject the drug and we can see the real-time image of the spread of the local anesthetic. So we are here injecting not the local anesthetic but the normal saline, which is also helpful how the drug spread when we go for the actual performance of the block. It is understanding for the students or the new delegates. We can say it is a again it will produce the confidence in them that I can do it confidently. So it is like learning to them. So better to do the mistake over here. So we can do the mistakes here. We can do the retakes here. So which complications are occurring. So it can happen in the cadaveric workshop. So it is to avoid the main complication occurring in the patient. So overall it will reduce the complications of the patients also. And again, we have the other research and innovation that we can do. We can do the dia studies in the cadaveric workshop. Then we can have the organized teaching models over there. So we can do the teaching models from this, and we can have that models in the curriculum of the PG students also. So we can go like that.
Ma'am, any message you would like to give to our young aspiring anesthesiologists?
Yes, I will say you should be updated, always updated with the newer techniques. Like we are doing the crab workshop, so it is always useful for them to learn different various blocks. What are the inventions? How to do the needling? What are the different techniques, approaches? So it will be helpful for them to learn in their PG curriculum only, and they can have that confidence in the further life. So it is better to learn beforehand before going to the actual practice. So learn everything here, do the mistake here, and go out with the confidence and ethics of the anesthesia, regional anesthesia. We can say like that.
Thank you so much.
Thank you.
So we are here with Dr. Shilpa Bhatt, Assistant Professor at Anaesthesia Medical College. Hello, ma'am.
Hello.
Ma'am, firstly, I would like to know, like, what do you think is the role of social media when it comes to organizations like AORA?
So when we talk about the role of social media, not just for an organization like Cadaveric, for nowadays any educational platform we talk about, it's no longer just an option or an add-on. It's absolutely necessary and vital at the same time. Because we have a huge access to when it comes to visibility, the good work which is being done by Cadaveric, especially the Cadaveric workshops are being organized throughout the country in almost all zones, and almost they are trying to reach all the states with the crab workshops. So it's important to have good visibility and to reach the target audience, which is nowadays the youth and the youngsters. So it's important for them to know what kind of work is crab AORA doing. How are we correlating the cadaveric research with the academic platforms and the academic knowledge that we have? How we can translate it to hands-on skill, and what exactly they should be blocking and how they should be going about it. So it's important to kind of put this information out there. So it plays a huge role when it comes to visibility. And at the same time for accessibility, especially when we are talking about the geographically challenged area or the population, set of population who kind of don't have accessibility to this kind of workshops. So they could probably look into social media and see where exactly these workshops are being conducted, what are they working on, what is their target, what you can gain from them, how prepared should you be, how should you be coming for the workshop. So all this kind of information can be shared through this platform. Also at the same time, I feel this is what the youngsters or the youth are looking for. Like they are more inclined towards learning, which is more engaging, more interesting than just your textbook or a lecture kind of learning. So, kind of sharing information, the vital information, in a very engaging way through short videos or reels, or kind of sharing what crap is kind of trying to focus on, could probably help them to get engaged better in these kind of organizations.
Ma'am, next I would like to know how was your experience conducting this workshop and also at our campus?
Uh, we have had an absolute brilliant time, a fantastic time here at the Walawalkar Medical College. We have been here for the last 2 days, so we started the day today with a master class. So the master class kind of gives the delegates an insight into what you should be focusing on, basically the A to Z of a nerve block. So they are kind of prepped before they directly enter the cadaveric research room. So they already know what they are looking for and what they should be targeting in these workshops. So we started with a master class, which was then followed by a hands-on cadaveric workshop. So in this part of the day, they actually had the needles, they tried to play around, they tried to see how you want to visualize using the ultrasound. So some tips and tricks were shared by faculty. It was more of an interesting and interactive session than rather just a mode of teaching. So the delegates were great. It was a good crowd, so they were very interactive. So it was a good session even with that, which was then followed by a live injection technique by Dr. Sandeep Diwan and the entire team, which was also very engaging, and we had good questions and feedback from the delegates at the same time. I think the home team, under the guidance of Dr. Sandeep Diwan sir and the lead faculty Sangamitra Ghosh, along with Dr. Leena from the home team, they did a fabulous job. The infrastructure was great, all the arrangements were great, and I definitely need to mention about the hospitality. It's been a lovely crowd, a great home team, and we had a great time here at Crab AORA in Devan. So wishing them all the luck. This is definitely a place where you should come and do your crab workshop and learn more from this team, because the infrastructure is great, the faculty and the team is great, so you should definitely consider this for your future workshop. We had a great time here, so thank you so much for having me and the entire crab team here.
Thank you so much, ma'am. We're so glad. Today we are here with Dr. Shweta Puntambekar, consultant anesthesiologist, Apollo Hospital. Hello, ma'am.
Hi.
Ma'am, firstly, I would like to ask you, why is this workshop important?
So we are talking about the Cadaveric Regional Anesthesia Workshop, which is a part of AORA, that is a regional anesthesia body, and this Cadaveric Research Academy Board, which conducts all these workshops. So we started our medicine by learning anatomy dissection on the cadaver, and that was our first year MBBS. After that, we did UG and PG in different specialities. But our first teacher was a cadaver. The anatomy, which is very important for all the specialities, that is a base of all the sciences. So when we go for regional nerve blocks, we should know which nerve supplies what muscle, which area is anesthetized by blocking which nerves. So again, learning anatomy is very important to know all the nerve blocks in detail. Another advantage of learning cadaveric workshops is you get to do hands-on, because we cannot directly go to a patient and learn on the patient by doing any procedure. But cadaveric workshop gives you that advantage of doing it hands-on, learning, doing some mistake, or again relearning. So that is the main advantage of all the cadaveric workshop. And it is very important for anesthesiologists to know the nerve anatomy, the blocks, various blocks, the musculoskeletal ultrasound, and especially after ultrasound in the now present era, ultrasound has changed the practice, because it's like a third eye. We can see the structure and block it, and we can reduce on the drug volume because we are specifically at the particular target area. So with the ultrasound, having this cadaver, we can scan from head to toe, locate the nerves, we can put the needle and see the exact target and inject the drug volume and do the nerve block. So that gives you confidence before going to a patient and trying new techniques. And this is all updating field, because all the nerve blocks are coming, newer nerve blocks are coming, and people want to learn. But this gives you hands-on experience 100% this cadaveric workshop is very important, and we are fortunate that we have this crab under Dr. Sandeep Diwan sir, who is conducting this workshop all over India, so all in a country can get this hands-on experience and be confident before going to OT and starting a new block, trying a new block. So it's very important.
Okay, ma'am. As you were the faculty for this workshop, so what does a faculty prepare before such workshops?
Yes. So, as a faculty, on behalf of all the CRAB faculty, I would take this question because we all are from different places in India. So, somebody coming from Coimbatore, somebody coming from Mangalore, some coming from Pune, then Mumbai. So, as a faculty, it's a teaching and learning experience for us as well, because before coming to any workshop or before coming to teach something, we have to again learn, relearn, update ourselves. We do go through the latest articles, the journals, or the new updates in that particular block. So we have to learn and come here. Same at the same time, we are doing our routine work, because some are in medical colleges, some are in corporate hospitals. So adjusting that, and again, because we have this passion of regional anesthesia and the nerve blocks, and of course when we meet together and we teach, we also learn. So it's always an ongoing process. So as a faculty, we are also excited about all the workshops, and we do prepare, because unless you are completely aware of what you want to say, or you are updated with the latest knowledge, you cannot give the knowledge. So it is our honor and privilege also as a faculty that we can do this again and again and get ourselves updated before going to any workshop.
Thank you so much, ma'am. We were so glad to have you.
Thank you so much.
Dr. Naveen from Kumaran Hospital, Coimbatore. Hello, sir. So, firstly, we would like to know, why is cadaveric training so important?
So this cadaveric program, what we are conducting in scrap workshop, helps us to learn what the anatomy looks like first. So being an anesthesiologist, we would have always come across this anatomy department in the first year of our MBBS. After that, not much. So this cadaveric workshop will help us to understand better about the anatomy and relation of the nerves with the arteries, facial planes, muscles, everything. And it also helps us in research, like the newer blocks which we are inventing, or the basic ideologies what we have. After a proper ethical committee approval, we can propose the idea and take it ahead to a cadaveric study. We can perform the CAD study using a dye injection, and after a period of time, we can do a cadaveric dissection, and we can identify the dye spread in the facial planes, or around the, is it perineal or periarterial, or in what facial planes, and in what facial dynamics does the drug diffuse, and how does it work. So if we are able to get a successful result in this cadaveric study, we can opt for a pilot study and use it for clinical patients.
So, how does this improve patient care?
So as a anesthesiologist, so we always tend to give the best for the patient. So if you are going to perform a regional anesthesia or a block per se, you need some months or years of training to first get your hands on the ultrasound machine and identify the structures, and then the proper placement of the needle, which is around the nerve without injuring the nerve, and proper placement of the drug. And if the drug placement is adequate, then only you will get an adequate pain relief. So all these process requires quite some training. So this cadaveric study will give you that advantage where you can scan on cadavers, take your time, learn the anatomy, understand the dynamics, put the needle, place the needle in the right plane, and you can improve yourself in the needling skills.
Okay, that was very insightful. Lastly, would you like to give any message to a young anesthesiologist?
Yeah, so being an anesthesiologist, it's always a holistic approach. So we see the patient as a whole. So pain is the most important factor we have to take care of in everyday practice. So this pain pain can be mitigated using a regional anesthesia technique and also using a multimodal analgesia. So this regional anesthesia technique, if you want to master it, of course, cadaveric study or a cadaveric research program is must. Is what my insight to being an anesthetist. So please do welcome for the AORA Guard Conference and the CRAB workshop, which is happening at Coimbatore and Ganga Hospital this July 2026. Thank you.
Anesthesia, Aora, FIRA. Hello, ma'am.
Hello. Hi.
Ma'am, we have come to know that you had conducted such a similar workshop in your institute, and now you are a part of the workshop here at our institute. So, how was your experience?
So basically, we did conduct a cadaveric workshop in association with CRAB in Yenapoya Medical College in Mangalore on February 1st. So basically, it was an honor to be able to be an organizing secretary and work alongside the CRAB board. Here, exactly after, basically after doing the workshop, it has opened a lot of avenues for us. And what I have realized is that a hands-on with the needling techniques and on the cadavers makes a lot of difference. Like we have been doing a lot of volunteer scans as well, but with the cadaver, it changes a lot of other things in the sense that you get a hands-on of the needling in a body before you touch an actual live patient. So the experience here has also been amazing because everything's been so well organized. All the cadavers are excellent. They're all theme embalmed, so it helps us and gives us a very, maybe very close idea of how it would be to block an actual patient. So it's been a good experience.
Next, we would like to know what does the future of CRAB Aora look like?
So basically, the CRAB board is coming up with a lot of ways to, spread what we're doing here. So what happens is we're actually going ahead and thinking of getting a logo out for the CRAB. Then we're getting a booklet. So this booklet basically is going to be given to the delegates before the workshop, where they can get an idea of what they basically look forward to, what they are going to be taught in a CRAB workshop, in a cadaveric workshop. After that, we're also going to start organizing faculty training programs. So what happens is all the faculty will be taught to basically have a uniform way of teaching. So there are basically a lot of faculties, and they go all around the country doing workshops every month. So they should have a uniform platform as to the exact way where they can teach all the blocks to all the delegates. So we're also going ahead with the faculty training program. So that's what we should look forward to.
Thank you so much. We are here with Dr. Pooja Jadhav, MD, Anesthesia, Fellowship in Aora and IDRA. Hello, ma'am.
Hello, hi.
So firstly, we would like to know why is this workshop important?
Okay, so this is a cadaveric regional anesthesia hands-on workshop. Nowadays, USG machine is everywhere. So if you are well versed with the anatomy and the needling and everything, then you can use the regional anesthesia as a sole anesthetic techniques for so many procedures. So I think in this era, we need this knowledge and also the hands-on for needling. So this AORA workshop, cadaveric workshop is important.
Next, we would like to know how did you like our campus?
Your campus, this Walawalkar campus is so green and vibrant, and the atmosphere is too great. So yes, I like your campus.
Okay, and lastly, we would like to know do you have any message for young anesthesiologists?
Okay, so for young anesthesiologists, I would like to say the practical learning is very important. So theoretical knowledge and practical learning, both the things are very important to perform this USG guided blocks. So if you know everything about that, then you can perform the block. You'll get a good success in the blocks. So I want to tell them, so try to attend at least one workshop, so you will come to know what is your knowledge and practical skill before the workshop and after the workshop. So yes, I would like to encourage them to join at least one workshop, one cadaveric workshop.
Thank you so much.
Thank you.